Hello, everyone, and welcome to our collaborative series of conversations addressing the issues of autoimmune disease in women. I'm Joyce Griggs from United States of Healthcare, and I'm joined today by my partners from My Care Friends, Todd Keats and Katie Seymour. And our guest, and I'm so pleased to say my friend, is Dr. Betsy Bennett, who will be talking with us about how to best communicate with your healthcare team. A little bit about Dr. Bennett. She's a clinical health psychologist and a faculty member at the University of North Carolina at Chapel Hill. She lives herself with an autoimmune disease. She's survived breast and lung cancer, and she has spent her career helping patients navigate life with chronic illnesses. Dr. Bennett, thanks so much for being here.
Thank you. I'm excited to be here.
Okay, so I'm going to jump in with our first question, which is, what do you think is the number one challenge that a woman with an autoimmune disease faces when it comes to managing communication with her healthcare provider team?
Okay, so I'm going to say something that I think no one's going to expect, but I'm going to say it anyway because I think it's true. I think that when you need to communicate with someone where you are going to need something from them, and that's what we're dealing with, right? You need things from your healthcare team. The first and smartest thing that you can do is to think about what motivates that person. What do they need? What are potential triggers for them? And because I've taught healthcare providers throughout my career, different area, but still teaching healthcare providers, I feel like I understand that one of the things, this isn't the best word, but I'm going to use it because it's still early, sort of triggers or isn't is an issue with many healthcare providers is that they want to have an answer for you. They want to have something concrete that they can do for you. And the very nature of autoimmune disease and actually chronic illnesses in general, even treatment. I mean, I think when I was on my, chemotherapy for breast cancer, there are many things that healthcare providers cannot solve. There is suffering that they can only partially alleviate. So one of the things that you can do when you're interacting with your healthcare team is one way or another, make it clear to them that you understand that they cannot fix everything you're bringing to them. You get that. And I've said that straight out. I remember before I was having symptoms, I have sarcoidosis, and I started with really, really severe fatigue. And I remember saying to my internist, I came in for another appointment, and I said, I want to start out today by saying that I understand you can't do anything for my fatigue. I understand that. So I'm not expecting you to fix it. I'm doing what I can do to live with it. But there are some other things that I'm experiencing that I felt like you needed to know in case that's going to help us solve this puzzle. Mm-hmm. So you see how different that is from like, oh my God, doctor, I'm so tired. I can barely lift my head, which is kind of how I felt. But I think that the more that because I'm I'm one of y'all too, the more that we can approach our healthcare team as a little bit more like a business partner and not so much expecting a lot of maybe emotional support, the better off we are. Like, hey, I'm here to help you help me get as much relief as I possibly can.
Why is that better for the healthcare provider to hear it that way? I'm assuming you're saying that this is a strategy for getting something from
Yeah, because I feel like it takes off their sort of emotional plate, the idea that they're supposed to fix you or that you expect them to fix you. When they know that you get it, like there's not a cure for this thing. You're just trying to get to a better place. That's a relief for them. And I believe maybe frees them up to think out loud with you and collaborate with you.
So you might get a more creative solution.
Well, yeah, because at that point, the provider no longer has to worry about, oh man, how am I now I got to let this person know that there's no fix for this. I can't fix her fatigue. You've already taken that away. Hey, I know that. So what else can we do here?
Would you approach it any differently for the recently diagnosed? Would you tweak this? Or would you say, no, even if you're recently diagnosed, this is the way to go?
I think it probably depends on how much you know about the illness you've been recently diagnosed with. So I think at that point, I might be, again, super collaborative, but might have maybe more questions. So it might be more, yeah, my fatigue is just killing me here. I'm guessing there's not a lot we can do for that, or maybe there is, doctor, you tell me. But I understand if there are limited tools for this, because that's what I'm gathering when I look into this or whatever. Again, leaving that door open so the doctor doesn't have to waste any cognitive energy on helping you understand that there are limited tools, perhaps.
I have a question for you, something that I share with people over time. Now, you have read about my story and so forth, and what I've learned through that and instinctually is that physicians are really strapped for time in this day and age. And that I always say to advocates, caregivers, patients, try and look at them as human beings, not necessarily as a doctor. Of course, they are the doctor, they're going to be helping you. But if we walk in and we realize they're a human being who has a family, who has a life, and they're so strapped for time, they have to fit certain things in. And if you say that to them, I have found with new doctors, and there's new doctors all the time with my parents, and I say that to them, look, we understand it's really busy for you. It kind of just, it has them relax, and you get more out of that connection.
Absolutely. I mean, I couldn't agree more. I couldn't agree more. It's so true. And I think we're going to get to this later in the conversation. That's what makes it, I think, so much more important that we're getting the support we need from our circle of loved ones and supporters, because in general, I mean, there are always these doctors who somehow manage to be exceptional, but in general, there's not the time or the emotional energy for them to be giving that to you. You need to be getting it somewhere else. Yeah.
Great. Thanks. That's great.
Another question is, and we sort of touch a little bit on this, but maybe you can expound further, is what are some of the common challenges that women with autoimmune diseases encounter when managing their healthcare team, and how can they overcome these challenges?
Yeah, boy, there's a whole world out there of research, and this is not my area of expertise, so I want to, full disclosure. But basically the idea that women and people of color, although we're talking about women here, but I want to add that too, are much more likely to have their symptoms and their complaints dismissed. Pain in specific, but talk about medical gaslighting is a phrase that we hear a lot about, and it's a thing. It's real. I think that one of the things that is very important for women to recognize is that particularly, autoimmune diseases are so characterized oftentimes by these vague, non-specific symptoms. If I think about it like, I'm tired, I have muscle aches, I'm thinking of some of these vague things, I have occasional stomach pains, like you can think of all these things, and you're at a sort of a high risk of being dismissed. Well, a lot of people have that. And so I would say that it's very important for any woman who thinks that she might have an autoimmune disease to be very specific about her symptoms and to be pretty persistent about, like, I know this isn't right for my body. I'm telling you, I'm having these things. I know this is not me. And I would like to problem solve with you to try to get to the bottom of this. And understand that there are women who unfortunately don't have a choice about who they see, and they might have to just keep being persistent with a provider who's not really cooperative. But for women who can come out of an appointment and say, that was no good, man, this person was not listening to me, they're not taking me seriously, I'm out of here. and to find some place where they're going to be listened to. And then, we're talking about people who have a diagnosis. If you have a diagnosis, again, very important to be clear and concise. And back to your point, Todd, about the limited time in an appointment, it can be very helpful to come in with a list and to say, I have no idea if these things are, in my case, I have no idea if this is related to my sarcoid, but here are the things since I saw you 6 months ago that I'm experiencing. Boom, 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 boom. And it's very important. I know that I communicate that because I have sarcoid in my lungs. It could be somewhere else. Sarcoid can be all over your body. So I need to pay attention to these things and I share them. And then it's up to my doctor to ask me more questions about for basically my pulmonologist to make the determination, do we need to explore, whatever, symptom it might be. But the more kind of crisp and clear you can be, and this kind of ties into something Joyce and I have talked about before, this is where it's very important, if you do track your symptoms, to not fool yourself into thinking that you can hand a bunch of graphs over to your doctor and say, see what's happening to my joint pain? That they're just going to be like, no, don't, you have to, and if you can't do this yourself, again, involve people who love you with maybe some other skills who can help you distill the data that you have down. So it might be, say you're at a 3-month follow-up, right? And that you've noticed that you have what you would call severe joint pain more than 4 days a week, something like that. And that's different from what it was. That's really what you need to say. Don't hand over the graphs. You say, in the past 3 months, I've been tracking it, and my severe joint pain is 4 days a week, whereas the last time I saw you, it was 2 days a week. I'm wondering if we need to do something here.
Yeah, those are great points. So you bring up the topic of gaslighting, and gaslighting is something that, as a part of this series, we're going to be focusing on. So we're really looking forward to that program. And I've been really, I've been touched, moved, not just by my mom's experience with an autoimmune disease, scleroderma, and how that just ravages a body. But I've spoken with so many women since then, and she was diagnosed 6 years ago. And I'm astounded by what happens. And when I talk about, all I have to do is say the term gaslighting, they have a visceral reaction to it. And I have heard the phrases that we all have heard, and others over and over, about, oh, it's all in your head. And, well, it's just your time of the month, or, whatever it might be. And one in particular, this woman that I spoke with over in the UK, who will be a part of our program as well. She's a young woman, and she kept saying, look, I know I have perimenopause. I know it. it. And they kept dismissing her. Ultimately, she was right. Yeah. So it does. It's really unfortunate. And you make a great point about journaling. That's going to be another part of our program as well. I
don't want to go too much down the road, because we all have these great anecdotes. But what's interesting about gaslighting is it can even happen when you have a clinical symptom. I remember, I was probably in my 40s, and I had a large lump in my armpit. I mean, it was palpable. You could see it. And I went to see a surgeon, and he said, it's nothing. Women can gaslight too, don't get me wrong. But in this instance, it was a woman surgeon who I went to for my second opinion. Oh, and he had said that it was mastalgia, which is sort of medical isms or medical ease for pain in the breast. Well, I was like, well, number one, it's not painful. And number two, I guess it could be breast tissue. It's under my arm, but that's not clear to me. And she said, well, if he had a mass in his testicles, would he say that he had testalgia? Probably not. He'd probably want it removed. And I just remember that like, oh my God, touche. But yeah, I mean, gaslighting, it's real and sometimes just unbelievable. Like sometimes when I tell that story still, like, I'm like, did that happen? Yes, it did.
I just wanted to sort of summarize a couple of things that you said. If you're having trouble communicating with your healthcare provider, maybe bring someone with you if you can't change or if it's impossible to change, who can help with the communication, because it's so important that you get through and that we not, just give up because we just don't know what else, we don't know what else to do. And or ask for a consultation outside of the exam room where everybody's fully clothed and, kind of sitting from a place of power. These are a couple things that, you can do when you come up against these challenges that are real.
Yeah, and I mean, we could spend a lot of time talking about the benefits of an appointment buddy.
Yeah.
And while I totally agree, Joyce, with like, it's better to be clothed and have a consultation, again, that's not always possible in a super busy clinic. And you could find yourself waiting another 6 months to have that clothed consultation. So I tell patients, ask for that. And if you can get it, great. But if you can't, be prepared. One of the things that I think about for the bazillion times that I've been in the freezing paper robe that crinkles and you don't feel like you're quite covered up, I tell myself this: it's nothing more than a costume. I'm in a costume that denotes patient. My doctor is in a costume that denotes provider. It's all it is. It's just a costume. I am still a human being. And when I tell you that I'm having palpitations or whatever it might be, you need to take me at my word.
Yeah. I love that. I love what you're sharing about communication and how important that is. And I think oftentimes, and the partner, your appointment buddy, oftentimes, using language like, this is not so-and-so's baseline, or this is not my baseline, has really supported me personally in the past. And I think that word maybe triggers something in the provider going, oh, okay, so anyway, it's just a tip that I have experienced. But I love, the talk about communication. I'm really curious more what it might look like with the decision-making process and the provider, and how important is it for us as women to, really, I would imagine important to participate in the decision-making process with the team. And I'd love to know some of the steps that we as women can take to assess preferences and priorities.
Yeah, so I'm going to tie this back into where you started with your question in terms of the appointment buddy. This is a place where an appointment buddy can be very, very helpful, because starting with kind of just taking a little turn back to the symptom reporting, another thing that an appointment buddy can do is check your own impulse. And I speak with love, because I do this myself, to minimize what you're going through. I think maybe my fatigue's been a little better, and to have your buddy say, that's not been mine, that's not what I notice, so that you have that participation there. And then when it comes time for like, okay, what are perhaps some treatment options, or if there's more testing that can or should be done, as the patient, your head can be spinning. Like, well, what did they just, you can feel confused or following one track in your mind, but not really hearing the rest of what your provider is saying. And the buddy can be the one to say, okay, so it sounds like we have a couple of options. We could get an MRI now, or we could wait another 3 months. Or we could go, right to this other specialist or something like that. Am I getting that right, doctor? And then be able to speak out loud a little bit about, okay, well, for instance, if we take the wait 3 months option, could this thing that we think we might find through the MRI get worse? Should I be hopping on that, in your opinion, doctor? And kind of getting the pros and cons of your different options, and then being able to say, I feel most comfortable with X because of whatever it might be. Or maybe, hey, can we talk about this at home? and we'll, call back and tell your nurse what we've decided. Something like that. Yeah, it's hard to do on your own, man. I mean, a buddy is a lifesaver. There's just too much going on. It's a lot cognitively, and to have someone there who's kind of got your back and helping you make it all very clear is very, very helpful.
Yeah. And sitting there with a pen and a piece of paper, writing things down as it's, as it's happening, because you can't do that, especially when you're in the paper gown.
Yeah. Yeah, exactly. Freezing. Right.
Exactly. So, when you have autoimmune disease, I mean, okay, you've already mentioned it, multiple specialists on your team. It's not just one doctor that you're working with. Do you have any tips for our audience as it relates to navigating the dynamics, the relationships among these various specialists on the team?
So again, I'm going to say something that sounds, I don't know, maybe controversial, but I'm going to say it anyway. You may not have a team.
Yeah.
You have these disparate specialists, and they literally probably never speak to one another. The only time I felt like I truly had a team was in my cancer treatment, probably. But for my autoimmune disease, not so much.
Okay. I mean, actually, I'm just going to interrupt for 1 second, because you know what? You're right. It's not a team. It's that you've got this group of specialists, and it's like, how do you coordinate, and then there's the issue of coordination of care. So let's just talk about that. The dynamics of coordination of care with this realistic picture that they don't work as a team. Yeah.
Right. I think one of your best friends is a printer. And I know that makes me sound very much my age, which I will not reveal here. Although I should be proud of my age, actually. But anyway, we're not going there. You need a printer. And if you don't have a printer, you need to get to be friends with your local Staples or whatever, because the best thing that you can do is print out any results from testing that you've had for various specialists and bring it in. These different EMRs, they do not talk to each other necessarily. And it is a huge mistake to think that they do. And sometimes even when they do talk to each other, it's hard for a provider from one system to get into the results from another system. So unless you are getting all of your care in a single medical center, in that case, they probably can, quickly call up, whatever's been done. But if you're anything other than that, you need to print the stuff out and you need to bring it with you. The other thing that I've done is I make up a Word document, always just a page, and as abbreviated as I can make it, with a timeline of my health history. I start with my breast cancer, since that was my first serious diagnosis. And, boom, 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 boom. And I had it every time. They look at it, it's brief, I have it in bold, and they say, thank you, this is great. And that's the kind of thing that you want to refresh their memory, give them new test results, and then they have it, they can understand it at a glance, and then help you get through the rest of the appointment.
I want to jump in here. I think that's an excellent point, and it's something that I do especially with my mom, because the autoimmune disease, of course, affects so many different aspects between CKD and ILD and so forth. So it's having that summary document ready to go, and then you can add to it. Another really important reason to have that is because with an autoimmune disease, and especially as it progresses and how it presents, you may end up in an emergency room that they're going to have no idea about your history. And if you can present them this right there, they have it. And that's so important. They're not going to be able to get everything typically because it's an emergency situation, but that has helped tremendously.
Oh, absolutely. I remember when I was first diagnosed with sarcoid, the surgeon, it was an accidental diagnosis, and I was lucky to get it. I'd been having all these symptoms and didn't know what it was, and then we found out in a kind of a weird surgical way. And I remember him saying to me, anytime you go for any care, the first thing you need to say is, I have pulmonary sarcoidosis. That's the first thing out of your mouth. And to your point, now I know that, yeah, just a well-crafted, printed out page that, boom, this is what I have. This is when I was diagnosed. Here's some critical junctures sort of in my illness. That helps everybody. It helps them not go down rabbit holes when they're trying to figure out how they can help you. It's very, very helpful.
Yeah, and one further point about the emergency situations. I always tell people with this document, if you can put it together, it's really important. Have on there what you are allergic to. Have
Yes.
on, because when you get into an emergency room, as you know, they just start throwing everything at it. And if they didn't know you were allergic to penicillin, or they didn't know you're allergic to whatever it might be, that's a problem.
What medicines you're taking because of
Yes.
drug interactions.
Yeah.
It's really important to have that accurate list for your specialists as you're going on appointments, and then in emergent situations. Unfortunately, we can't rely on the data and the systems.
That's right.
I mean, there's a lot of work happening in this area, but for now, it's really up to us. I think
It is.
individuals to make sure that they get that information.
Absolutely.
Yeah, and because, they can't take something out of you once they put it in you with an IV or a pill or anything else, I actually would say that this is for you or your buddy. I mean, if you are in an emergency situation, you probably can't think of this, but your buddy should know that they should always say before they administer you anything, are you sure that this is okay to have this medicine, given that my mom, my wife, my friend, whatever, is on boom, 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 boom. That extra step.
Yeah.
And it's interesting because I've had many nurses tell me that they always do that because they know how easy it is to make a mistake. So when they are the patient, they always, hey, before that IV goes in, just want to check. Are we okay that this is okay with these other things?
That's it's really important. And because my mantra to anyone who asks me is assume nothing.
Yes.
Assume nothing. I don't care if you're in the best facility on the planet Earth. Assume nothing.
That's right.
It's your body, it's your life.
Yeah. And I'd say the providers appreciate that. I think, we think
Yeah,
about this
absolutely.
idea of impulse and, I don't want to say that. But no, I think that, the repetitiveness is not problematic.
No,
Absolutely.
Yeah. And it's often the way that you say it as well.
Sure.
You don't want somebody to get their back up, and to your point, Katie, for sure that the healthcare providers, they're there because they care. They just, as we pointed out a few minutes ago, they're so stressed, they're so overstressed. So if you can help them, I think they really do appreciate that.
Yeah, for sure.
Absolutely right.
So, Betsy, how can a woman ensure that all the members of her family and circle of support are well informed about, the specific autoimmune condition and its implications for her overall health?
Oh, wow. This is a tough one. And the reason this is the tough one is that for most of us, the people who love us come in all different types, right? You've got the people who love you who want to pretend that's nothing wrong, that there's nothing wrong. You have people who love you who want to know everything, and they're so grateful for anything that you share. And in many more varieties than that. Those are kind of the first two kind of extremes, I guess, that come to mind. So the people who want to know everything are kind of they're the gimmies. And they're the ones I would say, bring them in first, because they want to know, they're eager to know. And for them, that's their toolkit for how they're going to help you. And they're anxious to do that. They want to do that. So gosh, a good example here is that, for instance, if any of you were to go and Google sarcoidosis, what you would find is that it's no big deal. That's the first thing that would come up. That like, oh, cadaver studies show that X% of people have it and they don't even know they have it. They're dead and we look at their bodies and we found out it didn't cause anything. And some people have it and disappears in a couple of years. Like no big deal. You really have to dig in to learn about that. I think it's something like 15% of people with sarcoid really, really get sick with it. And yes, you can die of sarcoidosis, but that's not what you find on the internet. So, and there can be similar experiences even with people with better known autoimmune diseases like RA, for instance, or multiple sclerosis or scleroderma, like you said. There's always going to be the person who's like, well, my neighbor Jenny's had that for years. She's fine. And that's what people are kind of eager to believe, that like whatever it is that you have is no big deal. So back to the gimmies, the easy ones, what I did early on is I found a website that actually talked about the 15% of people who really do get sick with sarcoid. So I'm in that group. And then that, helped my friends and my family who wanted to know, like, oh my gosh, what's going on? What is this thing? Easy peasy. Now, what do you do then? So for people who don't want to know, like the la-di-da-di-da, there are usually two reasons for that. There's either the reason of, I can't bear to think about my loved one suffering, or there's I don't want to think of the world as a place where suffering can happen, because then it might happen to me. And it might happen to someone else I love. So I'm going to defend against it. La-di-da-di-da, it's not happening. Mm-hmm. For someone who's in that position emotionally, you just might have to understand that the extent to which they can help you is going to be kind of limited. And that if they kind of, I'm going to use the word again, if they kind of gaslight you, well, you can't think it's RA every time you feel sore. You can't always think it's your arthritis. I'm sore sometimes. I think that at that point you have to understand that part of caring for yourself is protecting yourself from that. And that even though someone like that might truly love you, it might be a time that you maybe have to limit your contact with that person because they're not nurturing you. They're just not. And everybody else who's not in that place, they're going to be happy and actually relieved to know what to do or what to look out for with the illness that you have. And again, it's that same sense of like collaborativeness with this person who loves you. And then the others, it might take them some time and they might never get there. They might get, who knows?
Important. Take care of yourself, put yourself first.
Mm-hmm.
Number one, all of that, which sometimes is hard for people if you're not that personality type to put first, but this is a time when you really have to work on that. I think they have to hone that skill set to be able to put yourself first and have people around you who can nurture you and support you in very intentionally putting yourself first.
Mm-hmm. Yeah.
Yeah, I love that idea of personal boundaries. And, I'm even thinking about, does it make sense or would it make sense to just be, as the patient, like clear about, with your loved one, like, what is it that you need? How do you want to participate? I might put some boundaries up to protect myself. I think, depending on the relationship, that could look healthy.
Yeah. Wow. And one of the things I think that has been very, very hard for me to wrap my head around, so I'm still, I would say, in the process of doing this. Many patients will feel, maybe from the get-go or maybe as time goes on, because autoimmune diseases are just relentless. I love the way you put that, Todd. It's just so, ravage your body. Many of these diseases can do that. They can and will do that. To understand that the illness is happening to you and your loved ones. Mm-hmm. So it's like really bad weather. You aren't making it happen. the tornado is not your fault, but it is happening to you and the people that you love. And in some ways, that's a painful recognition. And then in other ways, when you can get to the point that you understand, like, I didn't ask for this, I didn't make it happen, it is not anyone's fault. That can be freeing for you to understand that the people who care for you are struggling in a different way, but they're struggling, and of course you are struggling.
Yeah, this is an unbelievable topic that we could spend another hour or two on for sure. And it's an important one. Maybe we'll have to come back and do something on this because it's such an important topic. And, I'm just speaking personally of just navigating that over the past 6 years with my mom and then my dad. But specifically, when I think of my mom and all the ways that scleroderma has affected her, and it just seems at times it's one thing after the next. It just keeps hitting and it's rolling. And it's really important as an advocate, the words you choose, and a caregiver advocate, the words you choose and the energy with which you express something to your loved one. It's not easy at times. Trust me, it's not easy, especially depending what's going on. But one of the things I do my best to try when she's, number one, it's always heartfelt. I'm so sorry you're feeling that way. I mean, you could just start with that and not say anything. That helps.
Yeah.
Another thing that I will often say, and this is with anybody, not just my mom, is I can't understand what you're going through, but I care so much and I want to understand, and I'll do all I can to understand and help you.
Yeah. I mean, so it's so powerful to hear that as the person who's going through it. It's so powerful. I think the understanding that this sort of goes both ways. And I mean, I don't know your mom, but I bet your mom hates to worry you. Yeah. And so you have this, like, in some sense, you have this wonderful gift of, like, to have this beautiful relationship where you love the person who's sick and the person who's sick loves you. But that also sets up this, you want to protect the other person, and so there's a lot there that is difficult emotionally for both parties, I guess, is the kind of the bottom line. And in that wish to take care of one another, things can sometimes get a little wonky. And as the person who has the illness, it's very easy to go down the rabbit hole of, it's my fault. I'm worrying my kids, I'm worrying my husband, I'm worrying my friends. I don't want them to worry. And to have to reframe that, it's like, no, you are not doing anything. The disease is making them worry. The disease is making you sick. The disease is doing a lot of bad stuff.
Yeah, you make an excellent point. There's a young woman, Brittany Foster. This young woman, I think she's 32 now, but she was born with congenital heart disease and has had umpteen surgeries and all different complications that come along. And when we first met her and we started talking about caregiving and advocacy, and she's a big advocate for the advocate, she just said, I sit there so often when I'm in the hospital, and she has been there quite often. She said, I look at my mom who just won't leave and I feel terrible and I want to help her.
Yeah. I'll tell you, if anything can get me crying, I'm like trying not to. That topic of the feeling of being responsible it's rough. It's painful.
Yeah.
Well, I definitely think this is a wonderful topic to do in the future, and I think we'll have to add it to our list. Sorry, everyone, but we have another one.
No, I think that's awesome, and something that I think everybody, either on the caregiving side or on the patient side, will get it.
Yeah. No, I think it's true. There is a sort of a making memories aspect to caregiving. I mean, good or bad. I mean, you can still make some good memories within these caregiving opportunities, that we have for one another to have this human exchange. So
Yeah, yeah.
Well, Betsy, this has been an amazing conversation. We just want to thank you so much for spending some time with us and adding to our library of conversations on autoimmune disease and women. Thank you so
Well,
much.
thank you so much. This has been
watching.
great. I really appreciate the thoughtfulness behind the questions, all of it. Thank you.
Thank you, Betsy.
Take care.